When you go to the doctors, how much is your pain? 0 to 10, and you have to pick the appropriate number to get the appropriate treatment. How much pain is too much pain? That is probably the number one question that I get with new evaluation and even old patients that I've seen for a while. They want to know, should I push through pain? Should I stop? What's going on and what can I use to be a guideline for me? So what we're going to do is break it down a little bit on the 0 to 10 pain scale. So typically what we hear is when you go to the doctors, how much is your pain? 0 to 10, and you have to pick the appropriate number to get the appropriate treatment. Because if you say it's a 2 out of 10, they're not going to treat you. If you say it's a 10 out of 10, they're probably going to give you way too many drugs. So what we're going to do is use that pain scale, change it up a little bit so it's actually useful for us when we're working out. So what we're going to do is visualize 3 sections. We're going to go 0 to 3 out of 10, 4 to 6 out of 10, and above 7 out of 10. 0 to 3 out of 10, that's discomfort. With discomfort, we just got to push through that. As you're going through rehab, as you're exercising, you have to understand that there's going to be a little bit of discomfort in it. 0 to 3, that's discomfort, we push through. 4 to 6 out of 10, that's our warning. When our body says something doesn't necessarily feel right, I don't like this, but it's not necessarily that nasty pain that makes us stop. So this is your choice. From 4 to 6 out of 10, if you think that it's too much pain, I want you to stop. If you think this isn't too bad, it's just a discomfort, it'll go away, go ahead and keep pushing through it. What I like to tell people in this range is that if you have any corrective exercises or accessory exercises that seem to work to decrease pain, do those exercises, see if we can drop down to this 0 to 3 level, and then push through it. Above a 7 out of 10, I typically tell people to avoid that. Now, that doesn't mean that we're causing damage when we're that high. 7 out of 10 pain, that's just a number. It doesn't really mean that there's more damage or less damage. That just means that your body is giving you a warning light and it's saying, I don't like this, I'm going to give the pain signal because I really hope you're going to stop doing it. That's why we want to stop, not because it's causing damage, but because it's giving these bad feedback messages to the brain where it says, let's compensate and try to move, try to change our position so that we can get out of pain, so we can decrease this abnormal threat. The problem is once we start compensating, we open ourselves up to a whole other group of injuries and problems. So obviously, if you're going to be doing a CrossFit competition, if you're going to be running a marathon or an ultra marathon, 7 out of 10 pain is pretty much expected. So we got to push through that. But on your everyday training, when you're recovering from an injury or pain, I would avoid that. So as a recap, 0 to 10 pain scale that's actually useful. 0 to 3 is discomfort, push through it. 4 to 6 is a warning, your call. Above a 7 out of 10 is when we avoid, not because it's causing damage, but because it's giving bad signals and causing us to compensate.